So I'm going to start with the apprehension test anterior. So for this one, you want them laying on their back, arm relaxed, and you're going to abduct the arm to 90 and flex the elbow to 90. And then for this one, you're going to support at the elbow and apply external rotation over pressure. For this one, if the patient feels apprehensive or as if their shoulder is going to dislocate or sublux, indicates weakness of the IGHLs, glenoid labrum, and anterior capsule. So next I'm going to do posterior drawer, so you can stay laying down. This one, you're going to abduct into mid-range and then flex the shoulder to about 30 to start, and then you're going to apply an anterior to posterior force at the GH joint as you apply more flexion. And for this one, if there's pain or increased laxity, it indicates posterior GH instability. So next I'm going to do clunk test. So for this one, they're also laying down. Going to abduct the shoulder to about 160, it's about right here. And then you're going to apply, or you're going to support at the elbow, and you're going to apply external rotation. And for this one, if they notice a noticeable clunk at the GH joint, it indicates glenoid labrum tear. So next I'm going to do load and shift, so you can sit at the end of the table. For this one, you want them to have their arm relaxed at their side. Relax. And then you want good posture. And then for this one, you want to grasp really good at the humeral head and then support over the GH joint. And then you're going to apply an inward load, and then you're going to shift anteriorly and posteriorly. And this one's going to be a little uncomfortable. And then if they feel, you're going to do that bilaterally. So if you feel pain or increased translation of the humeral head anteriorly, indicates weakness of the anterior capsule, SGHLs, and MGHLs. And then if it's pain or increased laxity posteriorly, then it indicates weakness of the posterior capsule. Next, I'm going to do the sulcus sign. So the same position, arm relaxed at their side. For this one, you just want to cup your hand over the GH joint and then hold the wrist, and then you're going to apply a traction force. And if you feel separation causing like a sulcus at the GH joint, it's indicative of weakness to the inferior GH. Next, I'm going to do the empty can test. So for this one, you can stand up, and then I'll hold it for this one. So this one, you're going to instruct them to flex their arm to 90, and then you're going to want to point your thumb down, so internal rotation. And then this one, I'm going to hold at the forearm and resist and have her push up against my hand. For this one, you can test it bilaterally. And if you feel weakness and sometimes pain, it's indicative of impingement to the supraspinatus tendon or the subacromial bursa. So next I'm going to do Kennedy Hawkins, so you can sit back down. So for this one, you're going to have them flex their shoulder to 90 and their arm or their elbow to 90. Probably do that in reverse order. So first have them flex their elbow, then their shoulder. And then next, you can hold it. Support at the elbow and apply internal rotation to the shoulder. And for this one, again, you can do this bilaterally, and if there's pain with the motion, then it indicates impingement of the supraspinatus tendon and subacromial bursa. Next, I'll do Jurgensen's test. So for this one, if you hold it with the other hand, and then stand here. You want to like, just kidding, cup the wrist a little bit with your hand. And for this one, you're gonna have them push against your hand with this at the side. So you're gonna support here probably so they don't move it. Then push against your hand while trying to supinate at the same time. And for this one, you can do it bilaterally. And for this one, if there's pain over the bicipital groove, it's indicative of biceps tendonitis or transverse humeral ligament. Next, I'll do Rue's test. So for this one, I'll have to hold it for you. You'll instruct the patient to abduct both arms to 90, and then flex elbows also to 90, and then bring your scapulas together, so retract, and then depress the shoulders as far as you can. Push them down. We'll try and keep this abducted. And then for this one, you'll instruct them to clench and relax their hands for 3 minutes. Usually don't end up having to do it that long. But if you notice them having difficulty with that, or that it like slows down, it's indicative of thoracic outlet syndrome. And then 98% of the time also includes a brachial plexus injury. Finally, I'll do Allen test. So for this one, I'll have you relax your arm here. So you want to find the radial pulse. You're going to take that. She was at 17. So you'll multiply that by 4, which would be 68, I think. So that's in the normal range of 60 to 100. So you're going to do that, and then I got to find it again. So then for this one, you're going to have them flex their elbow to 90, and then abduct their shoulder to 90. And then, so the whole time you want to keep your fingers on the radial pulse, and then externally rotate as far as it can go, and then have them turn their head towards the opposite shoulder. And for this one, if you notice the radial pulse disappear or significantly decrease, then it's indicative of the pectoralis minor muscle compressing the neurovascular structures.